I'm Briley. I work in ICU, and I would like to welcome you to our new home out here on medical floor. I will give you a quick but informative tour of our new ICU rooms. We'll start here in room 3124. It's one of our ICU rooms, just opening on June 1st. We have in our room the capability to do our epic charting. We have our scanner. We will be able to get our ventilatory equipment also at bedside. Up here also we have our cardiac space lab monitor. We have one of our new beds in this room, which also will assist with patient skin care. It has an adjustable pressure mattress, so addressing skin needs. Also, in this itty bitty little black dot in the ceiling is the camera. So when we are at the nurse's desk and when you look at other rooms, you may not have a direct view inside the room. This transmits an image to the nurse's desk, so we can always have an eye on our patient. Also, talking about eye in the sky over here, not only is this a patient television, they can watch all the standard, I believe, MediaCom channels, but it also is our interface with the telemedicine community. The camera on the top is what we will be looking at for telemedicine. They can look into the room. They can pan within the room if need be. Biggest thing with telemedicine is the TV needs to be on to access their services. This will be pretty much patient, family, visitor area here, allowing them comfort so as when they visit it's not as squish and tight as it was here in our ICU. Another big thing, which will be coming to all patient rooms, but we have available to us now, is our communication board. This will let us know our patient's preferences, also let staff know shift to shift and care provider to care provider what is going on with their patient at all times during the day. We can do our hourly rounding. We can tell who has which patient. We can, as you see in the center, is the patient's goal, what we hope to accomplish between patient and nurse. So this, to me, is going to be a really nice tool. And then for me, this is really exciting because we actually have showers in our patient's room. So we have a big, spacious bathroom in here. We would be able to easily wheel a patient in here and be able to let them shower, which before we've been moving patients out. Also, just looks pretty nice and clean and spiffy. Also, going back to patient-centered care, we have a lot of storage for patient belongings, and we have our classrooms both have curtains for privacy. All right, and behind this unassuming door leads us to our negative pressure care area. Anytime we have patients who require special airborne precautions, possibly suspected TB, something called disseminated shingles, which unless you're dealing with it, we won't go into that today. It allows us to essentially feed all airflow from that patient and patient care area out through some super hyped up special filters, which I don't know the exact name of, and pretty much filters it out till it's safe air and it filters it out of the hospital. So we have gauges here showing us when we have appropriate pressure. As of right now, since we have rooms that are, or the doors that are open, we're not achieving the negative pressure, but when these are good, we get green, and that lets us know that we have the right pressure. So in this room is essentially where we would get ready and put all our PPE on to take care of that patient. And we can always bring in more supplies into this room when needed. So pretty much we would go through this door, make sure the door that's behind us is shut and sealed, put on our PPE, which looks a lot of times like hazmat gear. And then once we know that that door is secure, we would go through this room, or this door, into what would be our negative pressure room, which is one of our, another, what would be referred to as ICU room. When this door is shut, and the door behind is shut, then we have achieved negative pressure in this room. Nice thing with this room, if we have any patients that require airborne negative pressure isolation, we can have them in this room. As well as actually all 4 of our ICU rooms, they're actually titled adjustable acuity care areas, so we can take medical patients here, observation patients, and ICU patients back here in this department. As you can see, this room looks very similar to the room previous, and just like our other 2 rooms, all 4 pretty much have similar floor plans, color schemes, and amenities available to both nurses and patients' family. This is Riley signing off and welcoming you to our new home.